On May 21st, 2001, Newland Stewart was born in John Muir, Concord. When Newland was just a baby, she was diagnosed with a glioblastoma, commonly known as a butterfly tumor. It was declared inoperable and could not be treated.
Panda, 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 panda. I got broads in Atlanta.
We have admitted a 5-foot Jane Doe who was in a terrible car crash and has suffered minor injuries, bruising, and possible fractures in the arms and legs. We need scans stat.
Thanks, Nurse Kaylin. Hello, doctors. Here are the results.
Hi. Jane Doe has 2 fractures in her right arm, in both the ulna and radius, as well as a fracture in her legs.
And it also appears that she has glioblastoma, and it is inoperable and there's no cure for it. And it's pretty big. You can tell that it's starting to swell up in the brain.
Here's the medical history you requested, Dr. Price.
Thank you. I've requested the medical information from the patient's current healthcare provider.
Okay.
So it appears that the patient's name is Newland Stewart.
Alrighty, and at the age of 10 was treated for appendicitis. At the age of 15, broke both of the arms. And then all the vaccinations are complete and is currently healthy.
Newland's scan results showed that she has fractures in the ulna, radius, and tibia.
Okay, so I'll start by disinfecting the arm and leg. Right.
Now we are going to bandage the fractures, and it'll take a few weeks for her to recover. But after that, she should be walking and moving just fine.
Thank you all for coming. I have hosted this meeting because, as you know, we have a patient named Newland Stewart who has glioblastoma in the brain. And as a neurologist, I would like to try to find a cure. I can't do it by myself, but I do need a team of helpers and supporters. And here we have Dr. Price telling me all of the symptoms and the things that could go wrong during the surgery.
Okay, so Newland Stewart was diagnosed with glioblastoma, or the butterfly tumor, when she was a baby. But it's been inoperable since then because it's been so close to the middle of the brain. So if we were to go in and do surgery on the tumor, it would cause brain damage or bleeding within the brain.
Radiation is very dangerous, and it must be done within a few weeks.
Within a few weeks? Because also, by looking at the scans, the swelling is going to increase, and I have to go in there pretty soon, or else there will be no chance of me even opening up that brain. How long do you think during surgery I could stand and do the surgery for?
At least 4 hours.
4 hours to get the whole tumor?
At least.
Okay.
I'm happy to assist with whatever treatment plan we choose.
Okay, I guess from now on I'm just gonna go find a cure. Nothing! There's nothing I can find! How am I supposed to find a cure? Oh wait! Oh my gosh, I think I missed something! The tumor's only in the frontal lobe. I think I could go in from the side of the brain. Guys. Emergency meeting right now in the conference room. Let's go. Thank you guys so much for coming to this emergency meeting. I just wanted to conclude that I have found a cure. Unfortunately, Newland Stewart will be the first patient ever with this method. But the first thing I'm going to do is I'm going to put in a fluid in the brain that will make it glow in the dark, and it's going to tell me where exactly the tumor has been affected. And then the second thing is I'm going to put a live virus in the brain, and it'll kill all of the parts that have been affected by the tumor. And after about 5 hours of operation, I think that the tumor is going to be completely gone in the brain. I do need a big surgical staff and I have invited people from all around the country to come and help me with this operation. Thank you guys for coming. It's a great day to save lives. Today is the first trial ever performed at Seattle Grace Hospital for the butterfly tumor. Here we go. Shaver. Scalpel. Fluid. This is the glow-in-the-dark serum. Now we wait 10 minutes for the glow-in-the-dark serum to work. Straw. Going into the fluid. Now I'm injecting the fluid into the brain. Suction.
His BP is dropping. He's crashing.
Okay, CPR. Start CPR.
We lost him.
Time of death, 1:45.
In the arms of the angel.
Wait, we have something.
Wait, what? Oh my gosh.
His BP is rising.
It's working.
Oh my gosh, it's working. The fluid is working. Okay.
Great job, everybody. You've made an ideal recovery, Miss Stewart. You should be back to normal within 1 or 2 weeks.